Greetings, class and professor. My name is Samantha Prasad, and my colleague is Katrina Apostle. We will be discussing collaboration learning community. Our presentation is based on collaboration and teamwork, and this is just an introduction of both of us. Again, my name is Samantha, and my colleague is Katrina Apostle. The first slide that I will be discussing is the significance of teamwork and interprofessional collaboration. So an interprofessional team consists of a diverse field that collaborates as a team. And teaming, the definition of teaming is that it promotes an effective quality of care, and it also mitigates operational downfalls. Healthcare facilities that promote interprofessional collaboration are prone to achieve a quadruple aim of healthcare recognitions. Also, an effective contribution of each diverse interdisciplinary improve patient outcomes and prevent emergency situation and also rehospitalization. It also could decrease mortality rate and decrease medical errors. On this slide, I have presented two examples of interdisciplinary collaboration. One, question A, it's about nursing informatics that leads with interprofessional teams and uses evidence to transfer data into actionable knowledge and also provide an insight of the healthcare organization. Also, the second example, I elaborate a cardiac arrest that a rapid response team assessed during or respond to a cardiac arrest in a healthcare facilities. Rapid response teams include various interdisciplinary professionals, that is nurses, physicians, respiratory therapists, transporters, hospitals, translators, hospital gospels, associates, and nurses managers, all who works together as a collaboration team in a critical situation and with one aim of providing an optimal patient care outcome. So I will elaborate a little bit about interprofessional collaboration or teaming. So interprofessional collaboration or teaming encompasses the dynamic of teamwork that occurs between healthcare members of different departments, who aims to accomplish one goal, which is providing an optimal quality of patient care. These collaboration involve, as I mentioned before, are nurses, doctors, physicians, respiratory therapists, pharmacies, radiology team, etc. Interprofessional collaboration is vital and for many reasons. It allows each interdisciplinary to bring their unique set of skills or expert to the team. Each team contributes a different role to patients' care according to their title. Preventing emergency hospitalization, decreasing mortality rates, as I mentioned before, and also decreasing risk for medical errors. These collaborations with different interdisciplinary members provide a holistic care to all patients in the hospital, within the hospital or within the organization facility. The other slide, the next slide that I will emphasize on is characteristic and behaviors that utilize creativity and diversity. On this slide, I will elaborate what is creativity and what leads to creativity. So creativity is not only considered as an individually, but also apprehended as an interaction between individuals' thoughts and social culture context. Creativity is also developed in a connection with individual interaction, environments, and different cultures. Creativity is a combination activity, a diverse group consisting of different perspectives, opinions, which can increase the experience and optimal patient care. The other slide that I will be discussing is the behavior. Just give me one second. Additional characteristics and behaviors to implement as a team leader. Leadership behaviors are considered a consistent action and habits that express a leader effectiveness. As compared to leaders' traits that are more about personality traits. Leaders' behavior are skills that individual can improve within their to improve with their practice, with proper practice, which includes adaptability and resilience, empowering and motivating others, self-awareness and continuing learning, seeking feedback and membership, or utilizing HRs to manage the team. An effective leader should be equipped to handle constant changes rather than being resistant. Encouraging and building team can result in potential team growth and organization success. Recognizing your strength as a leader and weakness can promote an exceptional leadership style. Achieving constructive criticism from your team can assist leaders to apprehend blind spots and areas for improvement. One of the most vital tools that a leader could use is talented HR. This is an excellent tool that leaders could use to design and shape their team to become effective and productive. The next slide, my colleague Katrina will continue on this presentation, and this is on behalf of her, I will be introducing Katrina Apostol. Thank you.
Hi, my name is Katrina. I'm going to continue on. In contrast to an effective leader, there are some characteristics and behaviors that may lead to an ineffective team collaboration. These characteristics include lack of team situational awareness, lack of psychological safety, and poor communication. First, situational awareness refers to one's ability to observe and perceive characteristics about their environment and surroundings. According to Welker et al., situational awareness within a team is significant, especially in the clinical setting, because it allows the team to implement cohesive, timely, and effective intervention. In healthcare, this can potentially save a patient's life. Team situational awareness can also contribute to a good shared mental model. This is a concept that refers to a team's common understanding of what their tasks and roles are within the team. This will then be discussed further in a later slide. Lacking team situational awareness, however, can lead to misunderstandings, miscues, isolated decisions, delayed responses, and the duplication or omission of tasks. If a certified nursing assistant or CNA, for example, observes a decline in a patient's condition but fails to notify the nurse, the opportunity to integrate timely interventions is lost, thus jeopardizing the patient's health. Second, psychological safety refers to how comfortable an individual feels within their social environment to openly express their thoughts without fears or repercussions. Team situational awareness can contribute to psychological safety. If the team is mindful of their surroundings and display communication, support, and initiative, then this will help ensure trust and foster psychological safety. A positive sense of psychological safety can then improve effective communication and feedback within the team. Lack of psychological safety, however, can result in unreported mistakes leading to adverse effects. Other outcomes may include withheld ideas and declined engagement within the team. Third, poor communication can be caused by the use of jargon or lack of open communication. Using technical terminology or jargon should be avoided when communicating to prevent alienating team members in differing professional roles. Instead, layman's terms should be used when necessary to avoid misunderstandings. Likewise, a work culture that values open communication should also be cultivated so that individuals may openly share their thoughts and opinions. This helps foster transparency, trust, and empathy, thus strengthening work relationships and increasing productivity. Psychological safety can contribute to the effectiveness of communication. If there's a positive sense of psychological safety, for example, then the team is more inclined to contribute their thoughts to the team discussion. The use of closed loop communication would also be beneficial in improving communication because it ensures that the receiving party accurately understands the information presented to them. Evidently, these characteristics and behaviors are ineffective for team engagement and collaboration. For this reason, it's important to develop a communication and interprofessional collaboration techniques that will instead enhance team engagement and collaboration. A few examples of communication techniques include active listening, open communication, and collaborative problem solving. First, active listening is a concept that involves a listener intently focusing on what a speaker has to say. Active listeners exhibits empathy, provides undivided attention, focuses on comprehending the message, and paraphrases the message to confirm comprehension. Active listening enhances team engagement and collaboration because it strengthens rapport and trust within the team while encouraging clear message delivery and open communication. Second, open communication refers to freely and transparently sharing thoughts with no concerns for judgment and repercussion. Open communication actually contributes to a positive sense of psychological safety because it empowers staff to express their thoughts. This helps build a positive work culture, improves staff satisfaction, encourages teamwork, and promotes engagement and productivity within the team. Third, collaborative problem solving involves team members contributing their skills and efforts to find a solution to a problem. This involves brainstorming and discussions within the team. This helps develop team decision making and build shared mental models. Next, a few examples of interprofessional collaboration techniques include building shared mental models and utilizing standardized communication tools. First, a shared mental model refers to the team's common understanding of what their tasks and roles are within the team and how they will coordinate to complete a common objective. Building a shared mental model within a team will help establish a cohesive understanding on objectives, enhance coordination, improve efficiency, minimize errors, and increase overall performance. Second, standardized communication tools should be utilized to ensure that there is a consistent, structured, and efficiency method to communicate across all departments. Having a standard for communication tools minimizes variations that could potentially lead to inconsistencies and errors. Frameworks such as SBAR or Situation Background Assessment and Recommendation should be implemented so that a standard for communication can be established. Misunderstanding is avoided and quality assurance is maintained. To assess team satisfaction and engagement, a few analytic tools can be utilized to measure these factors. Examples of analytic tools include employee net promoter score tracking, pulse surveys, and engagement index models. ENPS tracking is similar to assessing customer experience. However, it is intended for internal use to assess employees' experience within the workplace. Employees will be presented with questions such as, how likely are you to recommend this organization to a friend? And the employee will then answer using a 0 to 10 scale, with 0 being unlikely and 10 being likely. Promoters score 9 or 10, passives score 7 or 8, and detractors score 0 to 6. To calculate one's ENPS score, the percentage for detractors must be subtracted from the percentage from promoters. This is a fast and simple measurement to assess employee sentiment. Second, pulse surveys are short and frequent questionnaires that also measure employee sentiment. These surveys are conducted often at either weekly, bi-weekly, monthly, or quarterly intervals. It is a convenient tool because it takes a short duration to complete, and the frequency allows leaders to plot trends, track progress in their team's engagement, and provide a timely response to resolve problems. Third, engagement index models are frameworks that measures the happiness, health, well-being, and engagement of employees by compiling multiple engagement drivers into one composite score. This allows leaders to prioritize areas for improvement and track the effectiveness of engagement initiatives. Engagement index models are essential because high employee engagement has been correlated with several benefits such as increased retention, decreased employee turnover, improved job satisfaction, reduced absenteeism, etc. In conclusion, strong team engagement and collaboration is not developed by chance. It is built by respecting diverse skills, having effective leaders, mitigating ineffective behaviors, integrating effective communication and interprofessional collaboration techniques, and utilizing continuous measurement for improvement. Fostering strong teamwork is especially important in healthcare as it helps deliver safe, cost-effective, and high-quality patient care. Thank you.
Thank you.